evening, everyone. My name is Carly Shortino-Poulter, and I'm the director of the ARC Advocacy Network at the ARC of Indiana, and I'd like to welcome you all to Ask the ARC. In January, we began the year with our Ask the ARC webinar series, talking about the legislative session that was just beginning and what we were expecting at the state level and some of the things that were going on at the federal level. And now that we're halfway through the session, we wanted to do a check-in and talk to people about what's currently happening at the state level, what bills are still pending, what we're seeing with both Medicare and Medicaid and Social Security, and then also what's happening at the federal level. So tonight, I am very excited to introduce our guest speaker. So Tom Crishon is the Chief Legal Officer at the ARC of Indiana, and he's been working a lot on all of our legislative issues at the state level. And he can also talk about what the ARC of the United States is doing at the federal level. As we go along tonight, we would love for you to ask your questions. So if you could put those in the Q&A, we will ask those as we go along, and we will give you all of the information that we can. And what I mean by that is that there is still a lot of information that is changing, not even on a daily basis, but it feels like changing on an hourly basis. So we're going to give you the most up-to-date information we can, knowing very well that this could change by tomorrow morning. So at this time, I'd like to introduce Tom Crishon. Tom, thank you so much for joining us today.
Absolutely. Happy to be here. Thanks, Carly. First of all, I want to thank everyone who showed up at 6 o'clock and to get your evening away from 70+ degree weather outside. I really appreciate it. My name is Tom Crishon. I'm the Chief Legal Officer for the ARC of Indiana. I'm about 5 months on this job and in this role. Previously, if I've worked with you or seen you in past, I was probably with Indiana Disability Rights. I spent 14 years at the organization. The last 5, I was the General Counsel and Legal Director, overseeing our litigation and policy. So very happy to be here. As Carly mentioned, everything's moving very quickly. And so given the spot we are in the state legislative session, which is just past halfway mark, we thought this would be a good idea to touch base on kind of the progress and where we are in the state legislative session, discuss our priority bills, the ARC of Indiana's priority bills, and where those are, along with maybe some of the concerns that we're seeing kind of routing its way through the state legislative session. And then we will touch on federal Medicaid, what's happening at the federal level, largely Medicaid related, I'm going to touch on. And then if we have some time, maybe some ideas for public policy advocacy if you're interested in kind of what you can do at the state or the federal level. My plan is to leave some time for questions at the end, but there is a lot of material, so I'm going to try to whip through it quickly. If you do have questions, as Carly mentioned, please ask them. There's a Q&A section within the Zoom webinar software that you can ask those, and I've asked Carly to please politely interrupt me whenever questions come in so that I can answer them as they come. So with that, let's get started. Legislative session. Where are we? The Indiana General Assembly has recently passed over what's called our crossover deadline, which means we're just past halfway mark. Any bills that did not pass their House of Origin are now considered dead. So if they started in the House, they needed to get out of the House and cross over to the Senate, or they're no longer active. Any surviving bills are now assigned to committees in the opposite chamber, and they'll undergo hearings and votes from that standpoint and kind of start all over in the other chamber now. Just to provide a scale of kind of how big the legislative activity was, like what's going on, how many do we have? I pulled some numbers just to kind of share that. There were a total of 1,229 bills filed this year that broke down to 708 in the House and 521 in the Senate. To give you a sense of how readily they actually get out of their House of Origin, 334 survived. So again, 1,229 were filed, 334 survived in the first half. 530 died in the House and 365 died in the Senate. That is a 27% overall passage rate. So it's 1 in 4. Us lobbying at the State House and in the public policy realm, do our best to either get our bills through that threshold or not against bills that we don't want to pass. and continue on. So, the nice thing about the crossover deadline is that there's no longer 1,229 bills you have to pay attention to. Now we're on 334. So that is nice. At the crossover point, the legislator took a week break off and then reconvened on March 3rd. So we're about 10 days after they started back up on the opposite side. We were actively preparing for upcoming hearings, advocating for those priority bills to get scheduled and to be favorably considered. Our next big deadline, just to get a sense of where we are, April 15th is our next one, and that is the deadline for third readings in both the House and the Senate. So they have to get through their committee, and then either in the House floor or the Senate floor, they have to get through that third reading. If they don't pass that threshold, then they die for the year as well. Statutorily, the last day of adjournment will be April 29th, though it's expected right now that that will actually be April 24th. They're going to try to get all of the work done by then. We'll see. But again, very fast moving. The first half certainly went by fast. I am confident the second half is going to go by fast as well. So just to give you an update on kind of some of the priority bills the Arc of Indiana has really kind of advocated for in the first half, and kind of now that they've survived, moving forward with the second half. We're continuing our advocacy efforts really to advance key bills that impact people with disabilities and their families. And several, fortunately, of our priority bills have successfully passed their House of Origin and have moved on to the opposite chamber. We're actively working to get the bills heard if they have not already been heard in their committees. We're engaging with legislators, and we're pushing for significant policy changes on those. So I want to take some time to walk through a couple of those priority bills and what they would do, and why we're so interested in them succeeding. The first one is HB 1689. This is titled Human Services Matters, as descriptive as that is. And this is really in response to the significant changes made in 2024 at the Medicaid HCBS level. What this will do, especially as it relates to individuals with complex medical needs, it really ensures data-driven oversight and a collaborative planning process as the state moves forward to address some of those changes. So we feel that as it stands now, because there is a possibility of it changing, obviously, in the Senate, the bill strengthens oversight, it improves transparency, and enhances stakeholder engagement on our home and community-based services system, which is all critically needed. I do want to mention as well that while there were some very drastic changes that happened last year, especially as it relates to legally responsible individuals and providing family caregiving. We feel this bill takes an important first step, but we recognize that more certainly needs to be done to enhance services for individuals with medically complex conditions, and we continue to work toward that goal. But we do view HB 1689 as the beginning of an ongoing conversation to really strengthen and expand the supports needed for that population. So the bill does three main things as it stands right now. It strengthens oversight to the BDS ombudsman. It enhances transparency with Medicaid reporting, and then it facilitates stakeholder engagement for extraordinary care, those with extraordinary care needs. So I'm going to dig into those three just to kind of give you a sense of what it does. Relative to the BDS ombudsman, when the health and wellness waiver and the traumatic brain injury waivers were transitioned over to the Bureau of Development, or the Bureau of Disability Services, the BDS, last year when all the waiver changes happened, the oversight of those waivers by the current BDS ombudsman did not also flow over from aging. So currently, right now, those individuals under the health and wellness waiver or the TBI waiver has lost access to that independent advocacy and oversight by that ombudsman. And HB 1689 really just corrects that oversight. It ensures that the BDS ombudsman can work on those waivers now. And so any individuals who are receiving those services should certainly have access to the ombudsman support, who can help navigate services, resolve disputes, and really help to address systemic issues as well. So that really just expands their oversight. That was contained in a bill last year, and that bill, I think, inadvertently died And so the flow over of his oversight, the BDS ombudsman on those waivers also died with that bill. So that just really fixes that glitch there. On transparency, there is a lot of data collection and reporting requirements for the Medicaid HCBS waiver services, which is going to do a great job of informing both policymakers and stakeholders, kind of identifying gaps, improving service delivery, addressing underutilization of critical supports. So there's going to be a lot of reporting requirements, which will be very, very helpful as planning goes forward on what changes need to happen with the system. There's going to be a breakdown on service utilization by age, county, and service type, while also addressing barriers to access. Obviously, better data collection leads to better policy decisions, and we think this is really an important part of 1689. Finally, 1689 requires FSA to work with the DDRS Advisory Council to refine and develop plans for serving individuals requiring extraordinary care. Again, this was the big population that really was affected with those changes last year. And so ensuring that FSA has to come in front of the DDRS Advisory Council and kind of have a structured collaborative process, allowing families, providers, and advocates to play an active role in hopefully shaping those policies for the positive that impact those individuals with medically complex conditions and those individuals requiring extraordinary care. So really having a seat at the table is what it ensures. So again, we do think 1689 as it stands now does take an important first step in improving oversight, that transparency, that stakeholder engagement. But we do acknowledge that more work does need to happen, and we're going to continue to push for that with the administration as this progresses. So this bill did pass successfully out of the House, and we're waiting for it to get a hearing in the Senate Committee on Health and Provider Services. So as of right now, it does not need to go through Senate appropriations after that. So there is only that one committee that would need to see it and receive testimony and hearing. So that's the first big one. The second big one is HB 1285. Again, a very generically titled Education Matters. I'd be remiss also if I didn't mention 1689, the legislators who were very active in this. Representative Clear really kind of led this fight, but the co-authors in the House, Representative Porter, Representative Baining, Representative Pryor, all worked very, very hard and a lot of time on 1689. The Senate sponsors, Senator Good, Senator J.D. Ford, Senator Deary, and Senator Yoder. I wanted to mention that, given how much time and dedication they've worked to the issue, I wanted to make sure I mentioned those individuals involved. HB 1285, the education bill. This is Representative Cash's bill. Co-authors were Representative Davis and Representative Haggard. You might be familiar with this bill in that it initially would have required cameras in certain areas of schools. Specifically, it had a provision that required electronic recording equipment in designated special education classrooms, seclusion rooms, sensory rooms, and timeout rooms. We were supportive of that measure. We certainly thought that it would improve oversight and reinforce best practices. And that's how it was as it got to the House Education Committee. Unfortunately, that specific language regarding cameras was pulled out of the bill. The testimony was interesting at the House Education Committee in that there was no one who testified, whether it be the school side, the superintendents, the principals, the school boards. No one really testified against the policy of the cameras. The concern that they directed toward the camera aspect of this bill was on the fiscal. And so given the concerns with the fiscal and a very tight budget this year, and to prevent this bill from having to go through Ways and Means, and then if it's set aside at appropriations, the cameras were pulled out of the bill. The three remaining items of 1285 are very important, and it's a very good bill as it stands right now. And those three things, two of which were unfortunately prompted by situations that we saw in the state of Indiana. The first one on student property. The school cannot remove student property without first giving the parents an opportunity to collect in the tragic situation of a child's death. It was also expanded to include really any time the child leaves or withdraws from the school. Unfortunately, there was a situation where tragically, a student committed suicide, and the school gathered up the student's property out of the locker and the desk prior to giving the parents an opportunity. A lot of these seem to be common sense, but unfortunately, this does need to go in law to ensure that schools know they need to give parents the opportunity to collect that property before it's collected. The second situation, schools would be prohibited from adopting a policy that would prevent a parent from recording a case conference meeting or any meeting involving the IEP. Again, a kind of a common sense one, especially since there is another law. It's called a one-party state, where in Indiana, only one party to the conversation has to know about a recording. So they probably would have had the legal right to record the meeting anyway. But we did have a school district adopt a policy that would prohibited parents from recording an IEP meeting. Certainly, there's a variety of reasons why parents should have the ability to record the meetings. One, from a recollection standpoint of what was discussed. These IEP meetings, as we'll get to in the next bill we talk about, are always held during the school day. So maybe one parent can't attend, and that recording can be used by the parent who cannot attend. There also might be some disability related needs on being able to recollect, and so having the recording is beneficial. So that's a really good part of the bill. The last one is on nonviolent crisis intervention. This would require someone in each school building in the state of Indiana to be trained on de-escalation as it relates to restraints and seclusion. It is not a standalone position. DOE already has training that would fit this need, and we're hearing that a lot of teachers and school staff want to do the training, but this would mandate that at least one person in every school building is trained on the specific nonviolent crisis intervention. A lot of the bad situations we see as it relates to restraint in schools is because a staff person isn't trained properly on it or on de-escalation and ensuring that we maybe don't go all the way to the restraint. So this is a really important aspect of the bill too. This one, again, passed the House. It was assigned to the Senate Education Committee. We actually had a hearing on it yesterday, and it was, testimony was positive on it. No one was against it. It was testimony only, so it's scheduled to be on amend and vote next Wednesday. So we'll see if there are any amendments to it. We'll see next Wednesday. Hopefully that will get voted out with no or minimal changes out of the Senate Education Committee, so it can go on the whole Senate floor. The next one, moving right along, is SB 409. This was Senator Pohl's bill. There is a bundle of co-authors on this bill because everyone thought it was, and it is, such a great idea of a bill. It's going back to, I can't believe we have to legislate this. And that was really the general sentiment at the Senate hearing was, why do we have to legislate this? But unfortunately, we do. And so what this bill will do, this is it's entitled Employee Absence for Certain Meetings. And so what this would do is it would prevent an employer from taking adverse employment action against an employee who has to attend their child's IEP meeting. Again, common sense here. Certainly, parent involvement in IEP meetings is essential and critical to the collaborative relationship that parents and schools have as it relates to special education. But it has to be legislated. And so this again would prevent any kind of adverse employment action by the employer for that parent to attend a case conference meeting. It was expanded at the Senate committee to include absentee conferences as well, which is a specific conference in Indiana code when there's a number of absences that triggers this required meeting. So again, another good reason for parents to attend if there's an abundance of absences, to have that parental involvement. Again, the Senate committee went great. All the testimony was in favor. Everyone on the committee was fully in favor of this and requested to be added to the bill because it was such a great idea. There was even discussion on if we're aware of employers who take adverse employment action in these situations, that we need to make sure they don't receive state funding. Like, it was so strong of support at the committee that it was very welcome. It passed unanimously out of the committee with overwhelming support. When it got to the Senate floor, there was a amendment that was added that, while still a good bill, is a very concerning amendment that we're actively working now on the House side to revise. What the amendment that was added would do would allow for adverse employment action against the employee if the employee's absence from work to attend a case conference or meeting, as described, like the absentee conference, um, happened more than one time for one conference in a calendar year. So it limited the protections to a single case conference in the year. Certainly, case conferences typically happen once a year. Oftentimes, more than one case conference is needed, especially in those case conference situations where more than one is needed. Parental involvement needs to happen as well. More so, if I could say, than the ones that only happen one time a year. So that's a concerning limitation. Additionally, there's some language added about if the absence was longer than reasonably necessary to attend and to travel to and from the meeting. Okay. And then also the employee has to give the employer notice of the meeting at least 5 days in advance. Again, we don't like the amendment. We do not think that it was needed or required. And so that's a concerning amendment that now we're going to work on in the House side to try to revise that or try to pull it out altogether. The other aspect of that concerning amendment is that the employee shall make a reasonable effort to schedule a case conference or meeting as an electronic conference or meeting as opposed to in person. Again, there are a variety of reasons why it is beneficial to have these meetings in person, especially with as many individuals as involved in these case conference meetings. So again, a concerning aspect of the amendment. Again, we're going to work on this in the House. It's been assigned to the House Employment, Labor, and Pensions Committee. Otherwise, we do think it's a very needed and great bill with a very concerning amendment that we're going to try to work on. So those are the specific priority bills the ARC of Indiana is working on actively. But I did want to mention two other bills that we're working on, either trying to get language out of or trying to get language into. Just very briefly, SB 2, you've probably possibly seen some coverage on. It's a bill that would make some pretty drastic changes to the Healthy Indiana plan, the HIP plan. But substantively today, I'm going to talk about and focus on one amendment that was added to that bill. An amendment was added that would limit what they call advertising or marketing. And so of Medicaid program. And so we're very concerned about this language. It is extraordinarily broad, and I'll give you an example with the language that actually was added. We understand and appreciate the goal of preventing entities that stand to gain or profit from Medicaid enrollment from engaging in advertising marketing. We 100% understand that concern. And we share certainly a commitment to maintaining the integrity of the Medicaid program and ensuring that Hoosiers receive accurate and unbiased information. The problem is they don't define what advertising and marketing is. And also, it applies to everyone. And so what was added is it says the following may not advertise or otherwise market for the purpose of enrolling individuals in the Medicaid program. It includes state agencies, a person contracted for the Medicaid program, a health provider, a law firm, or the very limiting any other person or entity. So with the lack of a definition of what advertising and marketing is, and as it applies to any other person or entity in the state of Indiana, it's extraordinarily concerning. So as drafted, it certainly could unintentionally impede the important work of nonprofit and other advocacy organizations from providing critical information and assistance to individuals trying to navigate an extraordinarily complex Medicaid eligibility and enrollment process. There were some legislator comments when this concern was raised, that it was not their intent to prevent people from getting information they need about eligibility enrollment. We are now trying to convince legislators that to avoid that unintended consequences, this intent needs to explicitly be reflected in the bill. And so we've been in contact with legislators. We're actively working on trying to amend some of that language. This certainly, if it exists, if it passes as it exists now, there's many reputable nonprofit and advocacy organizations who play a crucial role in helping individuals understand their options, answer questions, provide guidance who will be affected by this. Our suggested amendments would be defining paid advertising and marketing, which would be for the purpose of intending to solicit, promote, or encourage Medicaid enrollment through mass media or digital platforms, and also specifically exempt out some entities, specifically nonprofit organizations and advocacy groups that provide general information and education about Medicaid and eligibility enrollment, as well as service providers, including case management providers who are serving those individuals. So that's a major thing as it relates to SB2 that we're actively working on. The other thing on HB 1001, which is the state budget bill, I wanted to mention that we are actively attempting to amend in, which I recognize is a tall ask given how lack of amendments in HB 1001 is right now and how it is a tight budget. An expansion to the MedWorks program, which is our Medicaid buy-in program. We're actively working to, if you're unfamiliar, it's a 20-year-old program that allows individuals with disabilities to work and still maintain their very necessary Medicaid services in their healthcare. So it is a 20-year-old program that has not been updated in 20 years. So the eligibility aspects are problematic, and we're working to try to expand the eligibility and the access to that program, which we think is a very, very good program within the state budget. So specifically, the asset limit right now of countable resources is a very, very low $2,000. If you have more than $2,000 in countable resources, you're ineligible for the MedWorks program. We're asking that to be bumped up to $20,000. Allow an individual to have some kind of an emergency fund. If their roof goes out, they don't need to take a loan out to fix it. They can save up for that expense because they're employed and still maintain their very necessary health care. The asset limit right now is at 350% of the federal poverty level. We're asking that gets bumped up to 500% of the federal poverty level, as well as the age limit right now is set at 64. The full retirement age under SSA right now is 67. We're asking it to be bumped up to 67. That program, individuals who are participating in that program pay a premium based on their income. And so, it meets a lot of the at least it meets a lot of the needs that they're trying to make in the general Medicaid program now. But we do think it's a very good program that individuals with disabilities who want to work and be in the workforce can. And unfortunately, given the very limited asset and income limits, we are seeing individuals with disabilities who remain unemployed or underemployed because of their need to maintain Medicaid. So we know that's not the goal of the legislator or the administration. It's for that to happen. So we're hopeful that this will get into the budget and we can expand that program so more individuals can participate and benefit from it. So that's the end of the state legislative action. There is a crossover legislative thing I want to touch on very briefly before we move on to federal action. Is the ABA and applied behavioral analysis changes. If you're familiar or if you're unfamiliar, back in December during the Medicaid forecast, the last administration, the Holcomb administration, in their Medicaid office, announced that they were going to amend the state plan amendment, offer a state plan amendment to the Medicaid program that would limit access to the ABA therapy under Medicaid. It would be capped at 30 hours per week for a maximum retroactive 3 years for lifetime. So if you had already been receiving ABA therapy for 3 years, you would be cut off. And so this was beyond the weekly limit. The retroactive nature of the 3-year cap. 3-year cap alone is problematic, but the retroactive nature of it was extraordinarily problematic. So we initially began the session trying to advocate for some legislation that would fix this and prevent the state from taking this action. Unfortunately, the state was planning this action in March or early April before the end of the session. So the likelihood of us getting that accomplished that would prevent them from taking action before they actually took action was probably not going to happen. So we kind of moved and worked with the administration to try to convince them of the need for the very drastic impact this would have and a need to rethink some of these limits. Representative Green was extraordinarily implemental in this work. Representative Cash was also involved. What resulted in it was a change. And you probably saw the news on Governor Braun's executive order on this. This is a very positive step in the right direction as it relates to ABA therapy. It would change the 30-hour limit and 3-year retroactive nature, and create a weekly limit based on the diagnosis itself. So if an individual is diagnosed with ASD level 1, they can receive no more than 30 hours limit. But if they're ASD level 3, then it caps at 38 hours. There's also an exception for individuals if they can document a need for more. There's an avenue for that. It does still contain a lifetime limit of 3 years, which again is very problematic. But it is not retroactive. So as soon as the state plan amendment gets approved, if it gets approved, that 3 years will start ticking then for moving forward on the 3 years. How we view that is that now we have 3 years to work on fixing that 3-year limit. So it wouldn't have any impact on individuals who has been receiving ABA therapy for 3 years now. We're strongly committed to eliminating that lifetime cap. It does not reflect the needs of people who need the services. But the other beneficial thing of the executive order that Governor Braun did was recognize that there's a need to talk about ABA therapy and what is proper and what's appropriate. I don't disagree with Secretary Rowe that the cost for ABA therapy over the last several years has really grown dramatically, and it is almost unwieldy from a cost standpoint. So the other thing that the executive order does is it establishes a working group to evaluate ABA services that will include legislators, stakeholders, and impacted families, and really kind of look at a number of things relative to best clinical models to utilize, recommendations for a better coordinated experience for children who receive ABA therapy. There's going to be quality measures. They're going to look at potential caps and whether the appropriateness of those weekly caps or monthly caps. And then there's a report that will be due to the governor November 30th of this year. So that working group is going to start work very quickly, be created very quickly, and start work very quickly. But I think it'll be very good having stakeholders, having impacted families at the table to really talk about the needs in ABA. And what is best practice going forward. So that's going to be a good opportunity to provide feedback on that. With that, I'm done with the state update. Carly, I'm going to stop and ask and see if there's any questions. I'm certain there are, but we'll go through some questions and we'll get to the federal update after that.
I do. We do have a couple of questions. And the first one really kind of bridges that gap or bridges that divide between state and federal, which is what Medicaid cuts are you anticipating that will affect people with disabilities?
It's a very broad question, Carly.
Uh-huh.
Anticipate is a very loaded word. And I think this is a very good segue into kind of what's happening at the federal level. So I think we'll just kind of get into that discussion if we could, Carly, because I think that'll answer that question.
I think that's
It's
great.
hard. Yeah, so it's a great question. It's a question that everybody's wondering, what the heck is going on at the federal level and how is Medicaid going to be impacted and how are individuals who utilize Medicaid going to be impacted? So let's just kind of get into where we are. I can focus really on the last week and a half or 2 weeks and have plenty to talk about. So let's just do that. At this point, as everyone's well aware, things are moving extraordinarily quickly, and things remain completely uncertain. So I don't have any firm answers for anybody, unfortunately. Really, no one has firm answers because we don't know exactly what's going to happen. But we can at least assess what's been happening, some of the things that have taken place, and we can kind of go from there. We know that some of the major budget proposals are in play, and we understand that Medicaid is under scrutiny. So let's just start about 2 weeks ago. a week and a half ago, with the first thing that really hit the news recently, which was the House budget resolution. I think it was late last week at this point, the House of Representatives passed a House budget resolution that could have major implications on Medicaid and other critical health programs. The resolution directed the House Energy and Commerce Committee to cut $880 billion over the next decade. House Republican leadership has insisted that Medicaid was never explicitly mentioned in that, and Speaker Johnson framed any cuts to Medicaid as targeting, quote, fraud, waste, and abuse. Though the scale of the required reductions, 880 billion, is a big number, raises concerns about broader implications, impacts on eligibility, services, and provider rates. The Senate will also be working on their own budget proposal. They'll have to come, just from a logistics standpoint, to a budget reconciliation process to come to some sort of agreement, because the Senate is certainly not going to adopt whatever the House does just blanketly. I will also note that there was an amendment to that House budget resolution, which was a week and a half ago, that required at least $2 trillion in spending cuts to secure $4.5 trillion in proposed tax cuts, with the possibility of further tax cuts if additional spending reductions were made. Certainly, this places added pressure on the Medicaid and other entitlement programs as being possible sources of those cuts. Okay, so that was where we were a week and a half ago. Very conveniently, on March 5th, the Congressional Budget Office, which is a nonpartisan office, was asked by some legislators about these $880 billion cuts and whether that is possible to make those cuts just from fraud, waste, and et cetera. The CBO, the Congressional Budget Office, came out and said on March 5th, they released a letter that really detailed non-Medicare mandatory spending that is under that House Energy and Commerce Committee's jurisdiction, outlining where that $880 billion in cuts that they're mandated to explore over the next decade would come from. The bottom line is the math is not mathing. And so Medicaid, CBO basically said that Medicaid would have to bear the brunt of these cuts. To give you some numbers, over the next 10 years, 93% of non-Medicare spending under the ENC's, the Energy and Commerce's jurisdiction, comes from Medicaid, totaling 8.2 trillion of 8.9 trillion in spending. There's an additional 200 billion that just comes from the Children's Health Insurance Program, the CHIP program. So even if all, this is the CBO's report, even if all other non-Medicaid and CHIP spending were eliminated, the committee would still need to cut at least $700 billion of Medicaid from Medicaid and CHIP, accounting for nearly 10% of the projected spending. So eliminating from all other sources besides non-mandatory spending is highly unlikely. So that number would even be higher. So the bottom line from CBOs on that House resolution was that it would all but guarantee that major Medicaid cuts would have to happen if they move forward with that plan, would certainly, as we all know on this call, would force states to either raise revenues or reduce spending, both of which would harm access to care, specifically for people with disabilities. So that was last week. Let's jump to this week, or I guess it was Saturday. Saturday, the House Republicans advanced a new spending bill. Why, you ask, did they advance a new spending bill last Saturday? Because the current budget only goes to 11:59 p.m. of March 14th. For those keeping track, that's tomorrow night. If they don't agree on a continued resolution, a further spending bill, that would prompt the federal government to shut down. As we've seen several times over the last year, that threat happened, or over the last several years, that threat happening. So the House Republicans advanced a spending bill last Saturday that would keep the government funded through September 30th, but also made some sharp cuts to Medicaid, the federal jobs and programs. The bill is endorsed by President Trump, but it's facing strong opposition from the Senate Democrats, who are going to see the bill next. So there's going to be, as you've probably seen in the last couple of days, a very high stakes showdown here with the government shutdown scheduled for tomorrow. So a little background on that. On March 8th, the House introduced a full year continuing resolution, appropriations and extension. This is HR 1968. And it primarily focused on increasing defense spending. It would reduce non-defense discretionary spending by about $13 billion. It would fully fund federal veterans healthcare services, and it would also provide the military a pay raise. This was on March 8th. March 11th, the House passed that bill by a narrow margin. It was, I think, it's 217 to 213. It was largely along party lines. I think one jump from each party to the other side. That means it now goes to the Senate side, and that's really what we're paying attention to now. The Senate is planning to debate this bill tomorrow. There's not an anticipated vote on the bill today. So we're going to know more about that tomorrow and what the Senate is going to do with the bill. There is at least some reporting that Medicaid the current Medicaid is not cut in that CR, that continuing resolution. I think that's going to have to get dug into a little more. And certainly we don't anticipate that whatever exists in the current CR is going to exist after the Senate touches it, even if they happen to pass it. I am not optimistic that we will not have a government shutdown for at least a little bit. I don't know if you've paid attention or not, but all parties are not exactly friendly right now. And so getting anybody to agree on anything appears to be difficult. And so we are certainly monitoring all negotiations, all budget negotiations, the reconciliation process. We're continuing to advocate for Medicaid, to protect Medicaid, especially as it relates to Hoosiers with disabilities. The Arc of the United States is doing a lot of active lobbying as well at the federal level. So, they're doing a really good job of keeping updates and providing updates on kind of where everything stands. All that to say, we don't know. I know that's not what you want to hear. I wish I had an answer. I wish this was more concrete, but unfortunately, we simply don't know. We know kind of what's happening in the last week and a half, what's being proposed, but right now, we don't know. As it relates to $880 billion, we do know if that moves forward and that mandate is continued, we do know the impacts of that, right? Because the CBO report says this is the math on it. And so we at least know from that standpoint where we stand on that. But we're going to know a lot more tomorrow. We'll probably know some more this evening. We'll probably know a lot more tomorrow and Saturday and Sunday and Monday and next week as we move along. But this is a very, I've been having to pay attention and research a lot in the last couple hours for this talk, for this presentation, just so I'm aware of kind of what's happening as we move forward. But that's kind of the unfortunately uncertain response on kind of where Medicaid is. Although, Carly, I did want to touch on a few of these federal agency changes that may have been hitting the news, so we're kind of aware of that, unless there's some other questions you want to touch on before that.
We do have a couple. I'm going to take us a step back because we got several questions about ABA
Sure.
and MedWorks that came in.
Yeah.
So first of all, how are members of the ABA working group selected? If someone is interested, how can they join?
So that's a good question. By the executive order, it's being selected by the FSSA director and the director and the Secretary of Education. So Secretary Robe and Secretary Jenner are the ones who will select those individuals to participate on the task force. The nice thing is the way that the executive order is phrased, and oftentimes how these working groups work is I'm pretty confident there will be an opportunity for public testimony and for people to come in, impacted individuals who don't necessarily make it on the actual task working group and share their story. And I think that'll be very essential to share how ABA is positively impacting loved ones' lives and individuals that you know and care about, because that's going to be important to relay how important it is, both how important ABA generally is, but also how impactful some of these cuts might be. But ultimately, it's going to be Secretary Robe and Secretary Jenner who selects those participants, and that has not been announced yet.
Okay. We've got a question about MedWorks. I'm a case manager who works with individuals who receive Medicaid on the MedWorks program. One barrier I see is that they are also required to meet Social Security disability requirements, although an individual doesn't want the Social Security monies. I have individuals who want to work full time and have the capabilities to do so, but would then be deemed ineligible for waiver services related to their Social Security ineligibility. These programs don't work well together. Many of my individuals still need social skills training by receiving behavior management and rec therapy to help them remain successful in their jobs. Is there any legislation work in this area? And if you don't mind, Tom, I want to go ahead and chime in on this just a little bit.
Harley,
Um,
feel free.
because and part of it is it is my mission in life to make sure people know about MedWorks, but there are actually two versions of MedWorks. There's regular MedWorks, and then there's one called MedWorks Improved, which is actually designed for people who've worked off of Social Security benefits. So the key with MedWorks is that at some point, Social Security had to say they were disabled. But if they work off of those Social Security disability benefits, whether it's SSI or SSDI, then we still have MedWorks available to them. But you're also right in that we've got a lot of people who can't get through that initial Social Security determination process. And Tom, that's where I'm going to turn it over to you to talk about that.
Yeah, unfortunately, the question as it relates to is there legislative action right now? No, there's not. There was MedWorks aspect was in some of these changes and tweaks to the program were included in some legislation on the first half. And the strategic decision was made that it might be better to try to get it into the budget because that wasn't moving. Unfortunately, there's not beyond the aspects that I've already discussed, kind of the increase of the asset limit, the increase in the income limit, and the age limit. There really isn't any proposals or any other changes right now to the MedWorks program. But I hear you, and I agree. And to Carly's point, it is a very well kept secret, and it shouldn't be kept a secret. Unfortunately, if the advertising and marketing language continues, it will be continue to be kept a secret. But there's only 3,400 people in Indiana at any given time who are participating in the MedWorks program. So it's not a big program, but it's a very impactful program.
All right. Those are the questions that we've had so far. So, ladies and gentlemen, by all means, continue to ask your questions in the Q&A. And Tom, I will let you continue on.
Okay, great. So I did want to touch on some newsworthy items as it relates to the federal government that have happened in the last couple of days, and just kind of if you haven't seen them, just make you aware. Unfortunately, we don't know the full extent to these impacts, but we're certainly going to be monitoring them. The first one, at this point, I'm losing track of days. So I don't know if this happened yesterday or if it happened today. It could happen Monday. I don't know. But very recently, there were some staffing changes, significant reductions in workforce with the United States Department of Education. And so this affected nearly 50% of its employees, as is being reported. This action aligns with the department's and the new Secretary of Education's quote unquote final mission to streamline operations and redirect resources, according to them, to students, parents, and teachers. As that happened, the impact of that was, as it relates to kind of what I want to touch on, the mass layoffs really gutted the Office of Civil Rights, or OCR, within the U.S. Department of Education. And this shut down regional offices, not all of them, but a number of them, and lift those offices understaffed to at least comparatively in where they were. I will note, OCR, in my experience, is already pretty overwhelmed with the number of civil rights complaints that it receives. They're the ones who oversee violations of IDEA at a federal standpoint level. And it's difficult if there's less people working on those. Just from a staff reduction standpoint, nearly half the staff were terminated. And the office closures, there were 12 regional OCR offices, and 7 of those have been closed. So the ones that were closed were in Boston, Chicago, Cleveland, Dallas, New York, Philadelphia, and San Francisco. That leaves 5 operational offices in Atlanta, Denver, Kansas City, Seattle, and Washington, D.C. So I wanted to mention You probably saw news of that. We're well aware. And to give you a sense of how many complaints were filed, last year, more than 22,000 complaints were filed from parents and students. And the majority of those complaints, they can cover any protected class, but the majority of those complaints actually involved students with disabilities. So certainly limiting the number of individuals within OCR that can respond to these complaints of discrimination in education is concerning. And so I know that the ARC-US is actively advocating about this, and it really wants people to raise their voice on this particular issue. The other, and again, I think this is going to be, we're going to see more and more of this as it relates to federal agencies, but the other one I wanted to mention is Social Security Administration, because it's so impactful to the individuals who receive services. SSA has also announced plans to reduce this workforce by approximately 7,000 positions, aiming to decrease levels from around 57,000 to 50,000. They say these are going to come from retirements, voluntary separation, incentive payments, and resignations. They're also streamlining operations by reducing their regional offices from 10 offices to 4 offices. So certainly, it's too early to exactly know the results, the effect that these are going to have, both SSA and education, on individuals receiving services. But the bottom line and the facts of it is that there's going to be less field offices and there's going to be less staff. So it's certainly something to be aware of as some of these changes are happening at the federal level. Again, I don't think this is going to be the last of the federal agencies we see a reduction in force, and probably not office limiting as well, and closing of some regional offices to streamline operations. So we're continuously monitoring, we're continuously advocating. But I did want to mention those two because those have been in the news recently. So if we have any questions, we get to questions, Carly. Otherwise, I can touch on if anybody's interested in some public policy advocacy and kind of what can I do. I can certainly touch on some of that if we want to do that, Carly.
We do not have any new questions at this time, but as we go along, guys, by all means, add them in the Q&A and we will talk about them.
Absolutely. Please do. So the first thing is stay informed. I think that's kind of a very critical thing. I say that understanding how difficult that it is to stay informed of all the happenings, because there's a lot of moving parts and a lot of changes happening. A very good way, I'm going to plug this, a very good way to stay informed is the Arc of Indiana's legislative update. We put one out every Friday. It's central around the happenings at the state level and our not only our priority bills, but some other things happening at the state level. But we do touch on big major issues at the federal level too. So I think that would be a very important first step to staying informed, but also just generally staying informed about the news and happenings. The other thing I want to recommend is if you have an interest in this, and I think everybody raising their voice is a good thing, is not only getting to know your local legislator, introducing yourself, but contacting them and relay, for the positive or the negative, what's happening, how it's impacting you and your family. We cannot stress enough how important it is to share real life stories and the impact of this. From the very beginning of this session, we've always been trying to combat that this is more than numbers on a page. These are real lives. These are our family. These are our friends. These are our colleagues that are being impacted potentially by some of these changes. And so it's very important to share those stories and how this is impacting individuals that you know or you love. Those voices carry significant weight with policymakers. And so it's very essential to, if you're willing and comfortable to do that, to do that. I think that, writing them, contacting them is very, very important. If you haven't already, even if there's not an issue, there probably is an issue, but if there's not an issue that you really feel the need to stand up and kind of say something to, it's still important to get to know your legislator and have your legislator get to know you, so that you're not just kind of running to them when there's an issue, but you can have that contact and say, hey, remember when we talked about X, Y, and Z. This is who I am. They know you and they know your story, and so you don't have to re-educate them each time on that. So I think that's a very important. The other aspect is you don't know who you're going to run into when. And so I think it's always essential to have a 30-second elevator speech. Here's something that you can say to a policymaker in a very short conversation if you find yourself in that situation. As a individual who utilizes services, as a family member of an individual, I firsthand see how Medicaid ensures children receive the care they need. Keto Medicaid, will result in, fewer well child visits. It will risk preventative care, the usage of the ER instead. These type of things just that you're ready for, you've put some thought into, and you really can convey that 30-second elevator pitch. I think is important to have. Those are just a couple ideas as we're running out of time here. But it's essential to use your voice and really, and again, not just on the negatives. If there are positive changes that are happening, and you're like, hey, this is fantastic, and this is why it needs to get over the finish line here. This would really help and have a positive impact on me. It has a positive impact on my child, on my mother. These are the type of things that should be communicated to legislators. And again, your voice carries significant weight, so it's important to use it.
We do have one more question, and I think it's the question that is in the back of a lot of people's minds and is what is leading to a lot of concern. What are the chances that I'll lose my Medicaid and Medicare Advantage due to cuts by the federal government?
I'm going to give you a very dissatisfying answer of I don't know. It really, things are, as I tried to kind of relay here, and even the last week and a half, things are moving and changing so very quickly. So I am not of the mindset that the sky is falling, because I don't think the sky is falling yet. And there's really I don't find it productive in my role to, react as if the sky is falling yet. I'm very cautious. I'm paying attention, and I'm advocating and doing what I can. But we don't know what those changes are going to be. As it relates to the continuing resolution, that they need to fund the government. As it relates to the $880 billion. If that continues, that may not. Just because the House passed the resolution doesn't mean it's going to happen. It could change. Everything can change, and simply we don't know. And so I don't want to necessarily speculate on those type of things without knowing, kind of for certain what's going to happen. But I think again, the important aspect of that is recognizing that there's a risk. Doing what you can to stay informed and plan ahead, and paying attention to kind of what's happening, and as best you can, making sure the organizations that you care about are doing what they can to try to affect the change that we can do. I know that's a very dissatisfying answer, but that's the only answer I have, unfortunately.
Well, and I think that this also reiterates the point you just made that it's important to share our stories.
It is very important.
So often, we expect that lawmakers and even, you know, government officials understand what these programs are. And you'd be amazed at how often they don't. You'd be
I
amazed at how often they don't understand the information. And so humanizing this, putting this in real terms, that my son's Medicaid waiver is what pays for him to get to and from work. His
Yeah,
Medicaid waiver is what pays for him to work with somebody to help him know how to interact with the public, and to work on those social skills so that he could maintain friendships and be more independent and do all of those things, because that's not what they think of when they think of Medicaid.
yeah,
They're only thinking of healthcare and ER visits and things along those lines. So I think this reiterates the importance of showing what these programs actually do and how this actually
yeah,
impacts people's real lives. Because when it's just numbers, that's when it's easy to dismiss things. When we've got a face, when they've got a constituent that they're talking to who lives this life, and they can say, "Hey, I have a seizure disorder. My medications would be thousands of dollars every month. There's no way I can afford that. This is what helps me live, like literally
yep,
live. And because of that, I have a family. I'm married. I work. I do all of these things that I could not do without this coverage, or whatever the
yep.
case may be."
Yeah, and I think that's a great spot to end on. I think for everyone just to be aware, a lot of people talk about Medicaid as a bucket, and Medicaid being Medicaid being Medicaid. There are in Indiana alone 37 different programs under state Medicaid.
Mm.
It is extraordinarily complex set of laws, set of services with different eligibility and different populations. So educating them on the areas that you are concerned about most and how impactful those particular areas of Medicaid are, and to not view it as a numbers on the page, not view it as a just one single bucket that we're going to chop in half, is very, very important. But it's sharing your voices.
Ladies and gentlemen, thank you so much for joining us tonight. Again, I want to make a shameless plug. If you are not already receiving the ARC's legislative memo, please sign up for that. You can do that through our website. We typically only send it out once a week, and that's during the Indiana legislative session. So we're not going to flood your inbox, but we will keep you up to date. If, for example, there's a vote coming up and you need to contact committee members, or whatever the case may be. But make sure you're following us on social media so that you can stay up to date, because the reality is these things are not changing on a daily basis. These things are changing on an hourly basis. And so that's really and you want to make sure you are getting your information from reliable sources, sources that you can trust, sources are getting you the most accurate and up-to-date information. So thank you so much for joining us this evening, everyone. And have a wonderful night. If you need anything, you're also always welcome to contact our family advocates at the ARC of Indiana to talk through your specific situation if something is going on, to find out whatever resources are available to you, or just to gather more information. And you can reach us at 317-977-2375. Thank you all so much, and we look forward to you joining us next month as well. Bye-bye.
Thanks.